So again, good evening to everyone. So our topic for this evening is related to the chain of infection. So we had a review of uh, the disease, or we have finished also the discussion of the periods of disease. Now this is related to the topic of the periods of disease, the chain of infection. And we have started already the concepts last time. Now, we have defined already before that the infection is related to the invasion of the microorganisms and parasites to the body. This may depend on the extensive damage that it creates to the body, if it will cause a mild or it may lead to death. However, this may depend on the response of the person, and it may depend on how the person be alert and alarmed when it comes to the management of prevention. So when it comes to the infection, we have discussed the chain of infection, which is composed of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and the susceptible host. Now, we usually associate with the infectious agent as it could be in the form of a virus, a bacteria, a parasite. And when we're talking about the place where these infectious agents or causative agents stayed for multiplication, it's with the reservoir. The reservoir could be soil, it could be animals, it could be humans, it could be objects. So when these infectious agents are present in the reservoir, we have the what we call portal of exit, wherein the infectious agent leaves the reservoir. So the portal of exit could be in a way of either through the blood, through the body secretions, coughing, through sneezing. These are the portal of exit. Now, we are considering now the mode of transmission. The mode of transmission could be through contact transmission. It could be direct or indirect contact. So the direct transmission occurred when there is close physical contact with the person, with bodily fluids, or entry to the person's skin, open wounds, mucosa. The indirect transmission comes from when the person harbored the microorganisms or the infectious agent through contaminated objects. So we can also have the mode of transmission to be as airborne. So airborne transmission, the microorganism suspends in air, and this could be through inhalation. The mode of transmission could be also other than the aerosol or the inhalation. This could be also through the bodily fluids, which could have a possibility of this infected body fluids may enter to the new host. Now, when it comes to the mode of transmission, we have the portal of entry. The portal of entry is from the reservoir's infectious agent. Portal of exit, the mode of transmission. The portal of entry could be through respiratory by inhalation, through the open wound, and could be through the skin. Now, if this already entered the body and started to multiply, the incubation period starts when we are talking about the disease process, periods of disease. Then whenever the infectious agent already entered the body, you have been considered a susceptible host, because eventually you need to do isolation. Either on a critical level, you need to be hospitalized, or after the isolation or quarantine period, you need to be vaccinated. It is called as chain of infection because we can break the chain. And breaking the chain could be the acquired knowledge, skills, and attitude of nurses on how they will apply those principles. However, we have defined infectious agents as the pathogens. anything that is caused by bacteria, viruses, fungi, or parasites. We have defined also reservoir as the one that where pathogen lives. So we set an example specifically later. I will give more examples. Now, on the portal of exit, it could be from the reservoir's open wounds, splatter of bodily fluids, or aerosols. So through the open wounds of the reservoir, coughing, sneezing, and through the saliva. When it comes to the mode of transmission, it's the way the infectious agent can be passed through indirect, direct contact. So these are contact transmissions. This could be by ingestion, by having the intake of contaminated food, water, so via the oral mucosa, inhalation via the respiratory tract. And we say portal of entry as where the infectious agent enters a new host through either broken skin. It could be via inhalation through the nasal cavity, through the mucous membranes, because the mucous membranes are highly vascular. This may facilitate the capacity to transport through the circulation. It could be through the catheters and tubes that had been inserted to the person, because these are foreign bodies that may cause the traveling of the microorganisms. Now, when is the time that you have been considered as susceptible host? You could be considered a susceptible host and you are already a vulnerable person if it caused already immunocompromise, wherein immunocompromised those individuals who may have the comorbidities and those who may need immediate attention. So breaking the chain could be facilitated in this way. So let's have an example primarily of the chain of infection. For example, we have the rabies. Okay, so the rhabdovirus. Rhabdovirus is the virus identified with rabies. So infectious agent is rhabdovirus. Usually the rhabdovirus stays with infected animals. So infected animals, not just only dogs, but any animals may have this rhabdovirus. It could just be only prevented if the animals will have uh, the vaccination. So if the animals have already the vaccination, it may prevent the portal of exit. So meaning you already break the chain. Now, when it comes to the portal of exit, since the saliva of the infected animals could be the source of the infectious agent, so how you will break from the portal of exit to the mode of transmission? Portal of exit, mode of transmission, and portal of entry could be managed through the what we call universal precaution of hand hygiene. Kasi eventually, when we consider the portal of exit, it's open wounds. So it has blood, it has secretions. Aerosol, it's via through the droplet infection. So we could, if the person already washed the hands, and if you considered yourself as a reservoir, then eventually washing the hands can prevent the mode of transmission. So you already break the chain. From the mode of transmission, since you are aware that you are on isolation because you had been contacted with a dog with a possible rhabdovirus, because you are not aware of the health status and condition of the animals infected with the rhabdovirus. So eventually, to break the chain, it is always we always take into consideration to have the hand washing or the washing of the wound with antibacterial soap. Thus, it may prevent the portal of entry. But if you did not manage it with the universal precaution of the hand washing, then it facilitates already that the infectious agent enters the body. So that's the portal of entry. And once it is already in the circulation, there could be chances that the rhabdovirus may affect the condition of the nerves. And usually it damages the nerves. So that's why whenever you experience fever, it's an indication that inflammatory process in the nerves are already existing. And you are now considered a susceptible host. And when you are when you consider yourself a susceptible host, then your objective is to prevent complications, and most probably to prevent Kasi you consider, if you are susceptible host, you may consider yourself already as going back to the chain as reservoir. So although there are few studies naman that if you have the rabies virus in your body, as basically considered po in the perspective of the concept of taking it from the infected animals, kasi it's still with the it's still with the bodily fluids. So you need to take into consideration that you must not also take into the risk that you may also have your secretions to be considered as in the portal of exit, which is the open wounds and mucosa. So whenever this happens, it will continue to spread the infection, just the same as for the COVID-19. So an example of COVID-19, so the infectious agent is the SARS-CoV-2. Before, we have considered in the Wuhan, we have considered po that the infectious agent is carried by the reservoir bats. And the bats portal of exit is the saliva. As from the portal of exit, the mode of transmission was indirect contact. So the indirect contact, the humans the humans touch the contaminated area or contaminated objects with the saliva of the bats. Now, how it happened? From the hands, it enters now to the respiratory mucosa via the nasal cavity. And through this, the SARS-CoV-2 enters the body and and it already started the incubation period and started the prodromal period when the client already have one of the manifestation, which is fever. Then now you have been tested and confirmed positive, you are now considered a susceptible host. So medical attention is very important. Now, if you will go back again to the cycle, the reservoir is not anymore the bats. The reservoir are now humans. So sa humans naman, ano naman yung portal of exit? Droplets. From the droplets, mode of transmission is direct contact. So from the direct contact, the droplets will lead to the person's inhalation or possibility in the oral mucosa. Then the entry goes with the upper respiratory tract. And then whenever there is fever, again another one of the manifestations, then you are considered as susceptible host. So these are the examples that we set when it comes to the chain of infection. Now, when it comes to the infectious agent, how we will break the infection? We can definitely break the infection through early diagnosis. Because eventually, for early diagnosis, you can facilitate to have the appropriate pharmacological treatment. For early diagnosis, it could prevent spread of infection. Through the diagnosis, through the diagnostic examination results, then it will have or it will prevent you to transfer or to transmit the infectious agent. Antimicrobial stewardship could be also one of the measures to break the chain of infections, because sometimes antimicrobial are used as prophylaxis. So meaning if we say prophylaxis for preventive measures. So a typical example is with the floods. So sa flood, usually most common problems that the usually Department of Health are saying is please prevent from placing yourselves to the flood because it could be infected by leptospira. The leptospira is coming from the urine. So yung urine of the kung si infectious agent si leptospira, ang reservoir niya ay rats, infected rats. So ano ngayon yung portal of exit niya? Ang portal of exit of leptospira is through the infected urine. So ano na ngayon yung mode of transmission? Yung mode of transmission doon probably it could be direct or indirect. Kasi it could be, for example, yung infected urine goes to the open wound, or either to the indirect contact, the urine are placed, the infected urine are placed in the contaminated object, wherein the person touched the contaminated object and placed to the open wounds. The portal of entry could be the broken skin. And once it will enter the broken skin, it will facilitate the circulation, and possibly this leptospira will cause the damage to kidneys. And thus, if there are already manifestations of possible bleeding or presence of blood in the urine, then this could be considered as you a susceptible host, and you may need medical attention. So in this scenario, it started with with the rats. Now, if you are already the carrier, you can consider yourself to break the chain upon knowing that you are high risk because you have open wounds. Then you engage yourself into floods, and possibly that could be infected by the leptospira, yung urine ng rats. So eventually, as an antimicrobial stewardship, the doctors will prescribe doxycycline. This may not directly treat yung bacteria, but basically to prevent the growth of bacteria because you have considered yourself as high risk. So yun yung prophylaxis. It already break the chain before you considered yourself as a reservoir. So next po, when it comes to the reservoir, since we considered even ourselves, humans, to be reservoir. So that's why whenever we considered ourselves as reservoir already and carrying as carrier rather, kasi ang reservoir we can use it as carriers. Even reservoir, we can consider the vectors. Mosquitoes, di ba? Yung mga mosquitoes, they are carrying the Aedes aegypti, are carrying the dengue virus. So going back to the situation of reservoir, if we considered naman na ang animals ninyo ay high risk for infection or carrier as well, then they need to be vaccinated. If the person naman is high risk because of the exposure, exposure to the or close contact to the person, then it could break the chain as reservoir through the vaccination. Now, if the reservoir usually comes from contaminated water, then basically you need to boil the water and prevent specific spread to the other family members. If you're considering naman infection coming from the soil, so that's why there are many microorganisms that are present in the soil, and it may enter to the skin mucus and probably broken skin. That's why it's very important to wash eventually mga wounds because this will facilitate the entry in the circulation. So what could be how to break the chain pag sa reservoir? Pag mga objects yan, then cleaning, disinfection, and sterilization. So what's the difference between disinfection and sterilization? For disinfection, the difference is it prevents multiplication. There is still presence of pathogens, but it lessen, okay? It decreases it prevents its multiplication. When we talk about sterilization, we have to consider po the total absence of the microorganisms. And this is usually whenever you use instruments in surgeries, sterilization is very important because of the high risk of open surgeries and may facilitate talaga the immediate travel of the microorganism. So sterilization is very important. Even for infants, di ba, you do sterilization of feeding bottles because this is eventually to really prevent. It's not just only cleaning the feeding bottles, but you do the sterilization. It's for purpose of killing the microorganism. But for the disinfection, you are just using only disinfectant solution to prevent multiplication of the pathogens. Infection prevention policies, so that's why we have mga health protocols, mga use of PPEs. So pest control pag ito naman ay caused by mga pest or mga parasites. Now when it comes to the portal of exit, the mode of transmission, and the portal of entry, what is common with these three? Breaking the chain is through the hand hygiene or what we call universal precaution. Another common measures to break the chain for portal of exit, mode of transmission, and portal of entry is through the use of the personal protective equipment or PPE. So it could be through the face mask. For now, face mask. Before we had the face shield. So another is for the portal of exit, since the portal of exit is by coughing, di ba? Sneezing. So respiratory etiquette could break the chain. So if you know that you're already kasi you cannot tell if you will not be you cannot tell that you're positive eventually if you are really tested and confirmed positive. But if you expose yourselves to crowd, you are not vaccinated, then you consider yourself as high risk. So the respiratory etiquette could do, if you cough and sneeze, you consider the tissue that you have used as contaminated na yan, and use and dispose it with the proper disposal, which is infectious trash bins. So that's why water disposal could be used for the can be used its concept of breaking the chain for the portal of exit. Kasi nga coughing, sneezing, and saliva as for the portal of exit. So, another is yung control of aerosols, kasi 'di ba sa control of aerosols, that's why it is based from the research that there is a need for 2 meters distancing, kasi in close contact, the meters that can still reach the person of droplet could be possible. So 2 meters distancing will do. So next po, when it comes to the mode of transmission, sa mode of transmission kasi actually ang situation now is the infectious agents are out of the reservoir na. So our concern now is where do these infection agents and secretions are present. Kasi it could be touched by the hands. So hand washing pa rin. So it could be anywhere else from the person, still personal protective equipment. Since it could be transfer, or it could be transmitted through the contaminated water. Kasi yung proper handling thing of food is very important. Kasi kung for example, if the person had been in the washroom and did not wash hands, so yung fecal to oral ang pwede mag-cause ng problem doon. So yung bacteria coming from the feces or the stool may touch the utensils, may contaminate the food, then you'll take the food which is also already contaminated. So from that perspective. But how about if the person managed to do hand hygiene pero yung food naman is are not managed accordingly with the with the appropriate preparation. So that's also a problem. So that's why in mode of transmission, we still consider cleaning, disinfection, sterilization. And when it comes to the mode of transmission, isolation is the number one aspect of breaking the chain. Now, whenever you are already high risk and you have concluded that I know you are confirmed that you have been exposed to close contacts, and at the same time you have utilized the kanyang mga things which may have direct contact sa'yo. So what could be the chain or breaking the chain? So still with the hand hygiene, still with the personal protective equipment, and usually this can consider also first aid. So yung first aid kasi para to at least, 'di ba, ang usual cause of the portal of entry is in particular with broken skin, respiratory tract, mucous membranes, catheters. So kung may wound, then definitely attend to it immediately. Wash the wounds, take the siguro mga anti disinfectant, rather the disinfectant solutions to manage the wound. So mga first aid measures. When it comes to the removal of catheters, class, anything that is inserted to the person can travel the microorganisms. So that's why you need to really check for signs of infection pagka sa mga intravenous site. Pag catheter naman, urinary catheter that is entered via the urethra, it can enter the microorganisms. So this is part of the nurse's responsibility. Kung if it is needed to replace, then manage to replace it. So another concern is basically on how about if you are already the susceptible host. Okay, if you're already the susceptible host, then after your quarantine, you need to be vaccinated na. You may receive immunization. So another is you need to undergo treatment if ever you are in the critical classified as the critical level. So in this situation, if you have managed accordingly treatment, medical attention, you have received vaccination, then you will prevent again the infectious agent to proceed to another host. So this is a typical example of how you will break the chain. And this is very important in pathophysiology because eventually when you will encounter cases of communicable diseases, there could be a possibility that a nurse can take part as part of the implementation and intervention in every aspect. You can actually use this concept aside from the periods of diseases, the concept of chain of infection when it comes to the pathophysiology. So you can pattern it through these phases. Next po. In particular, when we talk about application, okay, let us apply. In the periods of disease, we have already applied it in the incubation period. Di ba? Yun sa incubation, if you can still remember yung sa rabies or hydrophobia, the person had been infected or bitten by the dog, so he will have the incubation period of 10 days to 15 years. So 10 days is the most. Next, we have consider the prodromal period if the patient is already experiencing chills, fever. Tapos if the person is already experiencing difficulty of breathing, if the person is already having drooling of saliva, so that's already the period of illness. That's why it did not proceed to the period of decline and period of convalescence, simply because those symptoms are symptoms that the rabbit virus already reached the brain. So in this situation, let us apply the concept of the chain of infection from the rabies. So the infectious and causative agent is rhabdovirus. Then the reservoir of the rhabdovirus are possibly dogs or infected animals. Then the portal of exit is infected saliva. From the infected saliva, mode of transmission is direct contact because yung site of bite is wound, direct sa skin. At ang portal the portal of eggs entry is within the mucus. So it's either class yung infected lang na saliva na yon na may rhabdovirus, pwede yan through the oral mucosa kasi it could be absorbed agad yan eh. Eyelids kasi mucosa yan, broken skin. So once on the portal of exit and it caused already fever or any of the manifestations of rabies, then you could be considered na a susceptible host. Okay? So let us apply naman to pneumonia. When we go back to the discussions of periods of disease, sa pneumonia naman, we have considered yan as ang incubation period is 1 to 3 days. Sa prodromal naman, when it appears that the patient has fever. Pagka period of illness, the person already have the rusty sputum. Then, pag period of decline, nag-cause na ng minimal signs and symptoms until the person with pneumonia is the period of convalescence when he or she is cleared from the infiltration of the fluids in the lungs or other tests that can validate that the person is cleared from pneumonia. Let us now apply pneumonia naman in the chain of infection. Do you know that the pneumonia have various variants? Ang variants ng pneumonia ay it could be streptococcus, it could be staphylococcus, it could be Klebsiella pneumoniae. Yan po. Now, when it comes to the reservoir, ang reservoir naman na niyan ay infected person or contaminated objects. So ibig sabihin, kung infected person, direct contact, droplet. Kung contaminated objects naman, it could be indirect contact. So ano yung portal of exit? Yung portal of exit, yung secretions coming from the reservoir. At the mode of transmission naman ay yun nga, yung mode of transmission niya ay direct contact from the droplets or from the infected secretions at doon sa mga contaminated objects. Kaya that's why if the person has pneumonia, make sure na kanyang mga utensils at mga personal things ay nakaseparate po. So the portal of entry is via the respiratory tract from droplets, via respiratory tract. And once it appears, yung sinabi natin, nag-reach na siya sa ano. Sir, question, when is the time that you consider na yung incubation period? Mag-start na po ang incubation period pag naging or pag nag-involve na ang portal of entry. Kasi di ba we have divided the incubation period as the initial entry. So tapos pag nag-manifest pa yan, nag-manifest na yung sa prodromal, then you consider yourself na as susceptible host. Okay. So those are the examples. Now, I will connect an atypical example po dun sa concept natin na hindi na ako lalayo when it comes to COVID-19. We will try to relate it how the COVID-19 could be related to the chain of infection. When it comes to the infectious agents or pathogens, obviously the SARS-CoV-2 is the one that had been considered as pathogens. Now, when it comes to in particular cause the transfer kasi ang infectious agents natin yung SARS-CoV-2, alam nyo po it may depend on the three aspects. It could be by the number of organism. The more organisms po that enters your body, the chances that it will have the penetration and aspiration to the respiratory tract. Pag virulence naman, it may depend on the ability of this is the ability to survive. Survive po, yung ability to survive yung virus or bacteria in host or outside the body. So kasi may mga instances na our body is having fluids na meron tayong tinatawag na immunoglobulins. And immunoglobulins are antibodies. Kaya eventually kung iyan ay papasok sa body natin via the nasal cavity, upper respiratory tract, may mga immunoglobulins tayo diyan. However, if this could not be sufficient, dun yung time na ito ay nagsusurvive na, papasok pa to the succeeding part of the respiratory tract. Pero whenever the antibodies natin can really attack and prevent the multiplication of this virus, then eventually yun naman ay may not proceed to the lower respiratory tract. That's what you call virulence. Ang susceptibility naman, kasi pag sinabi natin susceptibility, kasi di ba usually ang first contact talaga ng virus ay sa skin. Okay? So usually ang skin is the first line of defense. And usually kung yan sa hands mo, kaya nga hand washing, kung yan ay nag-contact sa hands mo at tapos hindi ka nag-hand washing and you touch your face and specifically those mucosa, then you are really susceptible. So those are the concepts that we consider for infectious agents. Now, we've mentioned this in the reservoir. Reservoir could be for the COVID-19, could be human body, it could be through the skin, fluids, discharge. So nandyan, pwede dyan yan nag-reservoir, pwedeng sa blood, pwedeng sa organ itself, pwedeng sa any bodily fluids. Kaya usually nga yan, pag any of the bodily fluids are released from the blood, from the secretions, pero moreover, ang reservoir kasi natin is human. Kaya carrier. Okay, kaya that's why we use the term carrier. The person could be asymptomatic but have the disease. But there is a question that was addressed before. Sir, ang asymptomatic ba can transfer a disease? Yes, because carrier siya eh. Carrier siya. It just so happened that the immune system controlled the prodromal period. Pero carrier pa rin siya, capable pa of transmitting the infection. So other than reservoir, we have mentioned nga yung mga contaminated water. So these are environmental sources. Next, for the portal of exit. Ang portal of exit po ng SARS-CoV-2 or ng COVID-19 ay through the airborne. That will really airborne. So from the sneezing, from the coughing, ayan, suspend. Tapos less than 2 meters distancing. So that's the problem. It may cause the direct contact with the person. Number 4, let us now consider the mode of transmission. For the mode of transmission, we have considered po yung tinatawag nating direct or indirect contact. For the direct contact, this is usually yung direct and close physical contact of the person and the host. The source and the host. So, pag sinabi naman natin indirect contact, usually this comes from the mga contaminated articles, surfaces, objects, yaan ang tinatawag nating indirect contact. Another one, ito na po kasi yung kino-consider natin, yung droplet transmission. Yung droplet transmission is different from airborne. Yung droplet is coming from the secretions. Yung airborne, nagsususpend siya sa air. So, in this situation po, do you know that the virus lives in 12 hours? Kaya sinasabi natin that this infection can really can definitely must definitely be implemented kasi the suspension of the virus could live in 12 hours sa mga contaminated objects. So that's why when the person sneezes or when the person touches the contaminated object and inhaled, ayun, that could be considered as droplet transmission. And droplet usually travels 1 meter. So that's why ginawang 1.5 to 2 meters yung physical distancing. Next po, when we talk about the airborne transmission, airborne particles that leave the infected source, pero it enters now the susceptible host. So the virus suspends in the air. So aerosol siya. So when it comes to the portal of entry sa COVID-19 or SARS-CoV-2, we've considered as droplet spray into air when the person talks, sneezes, coughs, respiratory tract yan. The next that could possibly enter other than the respiratory tract could be mucous membrane, break in the skin, blood, gastrointestinal tract, genitourinary tract. This could be portal of entry. Pero sir, why is it highlighted lang ang respiratory tract, yung mucous membrane, pero it was not highlighted yung break in the skin, blood, gastrointestinal tract, and genitourinary? Kasi most ng mga droplet infection ay mas open ang nasal cavity to have this droplet infection traveled. Kasi kung wala ka namang break in the skin, it may not. Kung wala ka namang open skin at blood, ay magkukos ng infection, wala naman. So eventually kasi pag if the infectious agent enters the body at na-inhale yan tapos nag-cause ng damage sa blood vessel, so ibig sabihin nakikerry na yan dun sa blood. Pero eventually, pag if it is inhalation by the droplet infection, so respiratory tract. Sa gastrointestinal po, there could be a possibility na it could be killed by the acidic level or pH level ng hydrochloric acid in the stomach. And for the genitourinary tract, very rare. So how you consider yourself naman as susceptible host na? So syempre you need to take into consideration na yung immunity matters before you have been considered a susceptible host. Yung production of antibodies or immunoglobulins, tapos yung mucous membrane, normal excretory secretions kung these are already present in the body, so this has these antibodies. Remember po, yung pH level of 5 to 7 in the stomach, which is acidic, this will really prevent. Kasi let's face it, may mga secretions tayo na nasuswallow at it ends up to the stomach. Pero this could be managed kasi ang pH level ng stomach ay highly acidic and it could capable of killing the microorganisms. So next is we have the white blood cell, which is very relevant as soldiers of the body against infection. So I think we have already completed the topic for today. So do you have any questions for point of clarifications? Do you have any questions? So I know that it's been a long day for all of you, and since we have completed the topic for today in our pathophysiology, I also appreciated that you have watched the discussion on pharmacovigilance. So we will already conclude the day in our discussion for pathophysiology. I will keep you updated once the task has been posted in the Neo LMS. Thank you very much and have a blessed evening. Yes, Miss Abante, do you have a question? You're raising your hand.
Medyo unrelated na po siya sa ano natin.
Okay
Subject
po. Yes po.
Meron lang po akong gustong i-address kasi po di po ako sure kung anong gagawin ko. Nag-exam po kasi kami kanina with OB as well as quizzes ko, dalawa.
Yes.
Yung sistema po ba ng Neo LMS, halimbawa po na nag-2 attempts, hindi po kukunin yung mataas, rather ano po yung recent na attempt?
Actually, it may depend on, kasi it is in the setup. Sa setup kasi, pwedeng doon kasi kukunin yung highest score. Meron doon setup na kukunin yung highest score. So, just the same as for the BLE. Yun po.
Thank you po, Dean.
Thank you. So, I will keep you updated and by next week, expect for a quiz. But I will post in the chat group the coverage of the quiz for next week. So, probably we may have 2 for next week. and the other tasks that will be posted in the Neo LMS. So again, thank you very much. Thank you very much, Ms. Abante, for having assistance, and have a blessed weekend to everyone. Good night. Bye.
Thank you,
Thank you po,
sir.
Dean.
Salamat po.
Po, Dean. Good night po.
Then
Wala. Salamat
thank you po.